Occasionally, patients will need to be physically restrained during ambulance transport. These patients are usually severely agitated, combative, and violent for a multitude of reasons. Keep in mind that medical emergencies such as hypoglycemia, hypoxia, head injury, and intoxication can cause a patient to become unruly too. Never assume that the patient is simply acting out or trying to be difficult. While you may need to restrain the patient, a thorough assessment and treatment for any medical cause of combative behavior should be happening simultaneously. When the determination has been made that the patient is a danger to himself or others, reasonable force and restraint can be used. Reasonable force is the minimum amount of force used to control the patient. The goal is to restrain the patient, not to hurt them. Physical restraint is always the last option and should never be used as a punishment for a rude or uncooperative patient. Never attempt to restrain a patient alone. Positional asphyxia has been reported in the literature when patients have been hog-tied or restrained in a manner that impairs breathing. Patients should be restrained in a face-up or lateral position, never face down. In many areas, law enforcement or medical control must authorize restraint and treatment of patients against their will. Quickly perform a scene assessment. Make sure that the scene is safe and that the patient is not carrying a weapon. Have law enforcement ready to assist if the patient is carrying a weapon. Try to have an exit strategy and stay at least an arm's distance from the patient until actually ready to begin the restraint process. When the application of soft restraints is determined to be necessary for the protection of the patient, crew, or bystanders, take the following steps. BSI precautions. Plan your actions ahead of time. At least 4 people are required to restrain a patient. Each person should be pre-assigned a limb to restrain. Rescuers should all act at once to overwhelm the patient. Attempt to grab clothing or large joints. Avoid placing pressure on the neck, chest, or face to avoid interfering with breathing and/or getting bit by the patient. Secure all 4 limbs with approved restraints. The patient should be secured on the ambulance gurney or backboard in a supine or lateral position, usually with one arm up and one arm down. Placing a sheet or blanket over the lower half of the body can help prevent the patient from kicking. It is a good idea to have oxygen on the patient due to the medical causes of combative behavior. The mask will also prevent the patient from spitting on rescuers. Continually monitor distal circulation in restrained extremities to ensure the restraints have not been applied too tightly. If a restraint needs to be loosened, get help and loosen only one limb at a time. Once restrained, do not leave the patient at any time. Consider having extra personnel in the ambulance's patient compartment during transport in case the patient escapes restraint. Do not remove restraints unless sufficient personnel are available to control the patient, usually at the hospital. Do not allow the patient to talk you into removing restraints by promising to behave. ABCs should always be monitored in the restrained patient. Patients that appear to calm down may actually be deteriorating, so be vigilant. Attempt vital signs every 5 minutes in patients whose conditions are changing or are critical, and every 15 minutes in stable patients. Document why and how the patient was restrained. If the patient continues to struggle violently, requiring multiple people for restraint, consider ALS resources for chemical restraint.